Hi, my name is Rob Moody, and thank you very much for the opportunity of speaking with you. I do apologise that I can't get to Manila because of work commitments in Melbourne, but I'm delighted to be able to join you. And in particular, thanks to Ralph and to Irene for this opportunity of speaking with you. I do apologise for looking more like an airline pilot with these muffs and microphone, but I've just been trying to get the level of recording okay so that you can understand my accent. What I'd like to speak to you about today is the Australian National Preventative Health Agency, otherwise known as ANPHA. Um, and just to tell you a little bit about its history and its mission and its vision and its purpose and some of the key areas that it is focusing on right now. Um, Maybe I can start, I guess, with the fact that uh, this comes about. If we look at the slides, I hope that you've been given the second slide, that there are a number of preventative health reforms that have gone on in Australia, and that these have a fair degree of history. There's a long history of health promotion foundations with Vic Health begun in 1987, and with Healthway in 1991. Several years later, the Preventative Health Task Force was established by then Prime Minister Kevin Rudd and the Health Minister Nicola Roxon, and this was set up in 2008 to focus on the alcohol, tobacco, and obesity in particular, and the burden of disease associated with that, and how we might prevent this burden getting worse, and to do something more effective about it. In 2009, we produced the National Preventative Health Strategy. I had the honour of chairing this group, and a year later, about 6 months later, the government responded to the task force. And what they did was to actually then have the Australian National Preventative Health Agency Act in 2010, and ANPHA was established in 2011. Now, some of the drivers for this, as you can see in the next slide, there's a huge increase if we look at 2003 to 2017, as we're seeing now and is predicted into the future, of healthcare expenditure, just even if we look at three conditions: cardiovascular disease, cancer, and diabetes. And also that obviously more than half of the preventable of these hospitalizations are potentially preventable, and that there are really a third of Australians with at least one chronic condition. In our work, we looked at the burden of disease associated with many risk factors and found out in Australia that the key risk factors that we can really do something about, we can prevent their impact, is tobacco, blood pressure, overweight and obesity, physical inactivity, blood cholesterol, alcohol, and low fruit and vegetables. And our work focused mainly on the tobacco, overweight, inactivity, and alcohol, and low fruit and vegetables. The motivations behind this establishment of the agency, we've had a fairly good history of long-term comprehensive approaches with road safety, with tobacco in particular, with reductions in skin cancer, let alone obviously other areas of immunisation and cardiovascular disease generally. But in particular, there's a sort of a long history of these very comprehensive and effective public health campaigns. Also, the fact that government has shown significant leadership in this, as I mentioned before, with the establishment of the state-based health promotion foundations, and also there's been a long-term arrangement of partnerships with government and non-government organisations and academics and research institutes as well. So there's a long history of people working together, and this has gone even one step further with the establishment of the Australian National Preventative Health Agency. I mentioned two of the key public health successes in Australia. One is around tobacco control, and if you look at the next slide, then you can see this over 40 years that the arrows represent a major policy initiative, a major funding initiative, a major campaign. It just shows you, as you know, very well know in the Philippines as well, that good tobacco reduction takes a lot of persistence. It takes a comprehensive approach. It does take political will, and it takes a lot of very good advocacy. And I know how good you are at that in the Philippines. If we look at the next issue, again, a similar graph just showing the reductions in deaths associated with road trauma, the fact that these are reducing, but at the same time, as with smoking, it takes a lot of major advocacy work, major policy shifts, gathering of evidence, mobilizing of resources, mobilizing the community, and a lot of persistence to make these work. Now, if we look at the vision of ANPHA, then it's about a healthy Australian society where promotion of health is actually embraced by every sector, it's valued by every individual, and it actually includes everybody. So that's essentially our overarching mission, overarching vision. The mission is about being a catalyst. It's not about doing everything. It's about providing technical advice and assistance, and to all levels of government, because it's not just federal government, but state government and local government, to promote health as well, obviously, and to reduce health risk and inequalities. If we look at the functions of the agency, then it is about providing advice and recommendations to the Minister for Health federally, to the state ministers of health, to the local government across Australia as well. It's about collecting and analysing and synthesising information relating to prevention. It's about developing national standards of practice and also managing a system of awards for good practice in health promotion. As importantly, it's about conducting educational and promotional awareness programs around promotion of good nutrition, reducing tobacco use, minimising the harmful use of alcohol, and reducing the incidence of obesity. And it's also about bringing people together. It's about national leadership. It's about bringing the key players across the country together from state level, non-government organisations, academics, as I mentioned before, and industry where that's appropriate. Obviously, it's not appropriate to bring the tobacco company in on these simply because they have such a huge conflict of interest. As a governing body or advisory council, the CEO of ANPHA reports directly to the Minister of Health and to Parliament. And the CEO is advised by an advisory council, which is made up of senior state government leaders, academics from public health, from clinical medicine, from general practice, from local government, from Indigenous Australians, and from non-government organisations. The current priorities, as I mentioned before, obesity, tobacco and alcohol. There is an emphasis on this combined approach of individual behaviour change as well as on changing the social determinants of health, and in particular looking at how we can minimise inequality, inequity and disadvantage. Also, the agency has much to do around helping to develop the health promotion workforce and the public health workforce, and is a major supporter and funder of research, relevant research in this area as well. If we now look at some of the priorities, then on the next slide, then you can see one around obesity, obviously, running some campaigns, two campaigns, Measure Up campaign and Swap It, Don't Stop It campaign. It's about monitoring the food marketing to children and advising government on this, and also developing the evidence on community-based prevention initiatives and options for scale up. I mean, to be honest, this is not an area that we're doing terribly well at the moment. It's a difficult area, as you will well know here. The power of the industry, particularly here, we have enormously powerful Food and Grocery Council, and as we've seen with tobacco and alcohol, then companies like this are in a sense, because of their conflicts of interest, are virtually undermining every good public health attempt to manage this area. So it's a big challenge in Australia, as it is globally as well. If we look at tobacco, this is an area obviously we think we've done much better in. There's been a national tobacco campaign now, plain packaging, major graphic warnings, obviously, and most importantly, price rises through tax increases. And these, I'm convinced, will be the most effective um, methods to bring the prevalence rate below 10% that we want to do by 2018. All the governments, state governments, federal government has signed onto this target to reduce tobacco smoke to below 10% by 2018. When we look at alcohol, then the major priorities around the national binge drinking strategy in Australia, then overall consumption rates over the last 10 years, well, they're going up and then now they're coming down a little bit. But big changes have really been in the last 20, 30 years about how we drink, and the notion of binge drinking has become a big issue. And now ANPHA, for example, is focused on community level initiatives, the Community Sponsorship Fund, national telephone counselling numbers and standards, and arguing for a national minimum price for alcohol and working in the area of advertising and labelling as well. One of the more interesting campaigns, I think, is what we call the Be the Influence campaign, which is a buyout of alcohol sponsorship in 16 major sporting associations across Australia. We still and this includes soccer, as you know, football in the Philippines, netball, surfing, hockey, basketball, a number of different sports. We still have yet to get a couple of the football codes and the cricket involved in this, but it's a really good move in terms of getting alcohol sponsorship off our television screens and out of our sporting venues as well. A research program run by ANPHA. It's a real emphasis on translation of evidence into effective policy and programs. There's been a project grant system and development of a national research strategy to try and bring everybody together to focus on what are the key issues for prevention in Australia, obviously around obesity, tobacco and alcohol. And lastly, if you'd like more information, then go to the website www.anpha.gov.au if you'd like more information. And again, I'd like to finish by thanking you for the opportunity of speaking with you, and just to say, I guess, how inspired we are by the work that you're doing in the Philippines, by the passage of the Syntax Bill, and by the fact that we're very pleased that we can work on these issues together because they are fundamentally very big global health issues. Thank you.